Well, the gut really is the central mechanism in everything. And during embryology, as the fetus is developing, the very first part is the gut, basically the nervous system of the gut and the immune system that surrounds the gut. So even in embryology, it's the gut, immune system, nervous system of the gut that then drives the development of all the other body parts.
Welcome to the Radical Health Rebel podcast. I'm your host, Lee Brandon. This work started for me several decades ago when I started to see the impact I could make on people, helping them to identify the root cause of their health problems that no doctor could figure out, including serious back, knee, shoulder and neck injuries, acne and eczema issues, severe gut health problems, even helping couples get pregnant after several IVF treatments had failed. And it really moves me to be able to help people in this way. And that is why I do what I do and why we have this show. In this week's episode of the Radical Health Rebel podcast entitled Gut Health, Autoimmunity and Chronic Disease, I spoke with Dr. David Bilstrom, a fellow of the American Academy of Integrative Medicine, as well as an advanced fellow in anti-aging, regenerative and functional medicine. Dr. Bilstrom is on a mission to revolutionize how autoimmune and chronic disease is treated worldwide by teaching the science-based fundamentals of functional medicine. And in this episode, we discuss how gut health relates to autoimmunity and chronic disease. This was a really fascinating conversation and one that branched out into many areas of health, all of which are affected by the gut. Dr. Bilstrom also gave many pieces of advice to optimize the gut health and reduce the likelihood of autoimmunity and chronic disease. If you have any interest in gut health, autoimmunity, and chronic disease, you're really going to love this episode. Dr. David Bilstrom, welcome to the Radical Health Rebel podcast. Thanks for coming on the show.
Oh, my pleasure, Lee. Thank you for having me.
Yeah, it's great to have you here despite the technological challenge that we've had this morning. But we're here and we're doing well. So, Dr. Bilstrom, to kick things off, could you share a little of your background, your career to date, and how you became specifically interested in autoimmunity?
Oh, sure, yeah. So originally my area of expertise was spinal cord injury rehabilitation. So all of my patients were either paralyzed from the waist down or the neck down. But that taught me a lot about the gaps in treating chronic health issues with only traditional interventions. And boy, there's a lot of gaps. And then my son got a debilitating disease when he was very young. Nobody could figure it out. I had no choice but to search for the answers and find them. And he did so great that I'm like, well, I'm going to start specializing in reversing autoimmune and chronic disease. In the first place, in my private practice near Chicago. But then, and I was treating a lot of autoimmune disease, reversing it. But then there was this story in the New York Times that really, boy, hit your heart. It's about a famous journalist who was losing not just her career, but her life to lupus. And I'm like, oh my gosh, something has to be done about this. Somebody's got to get out there and change the way autoimmune disease is dealt with worldwide. And, let people know that there is a solution to this epidemic of autoimmune disease. And we moved from Chicago to join a small teaching hospital out in Idaho, thinking that in order to change the way this was done worldwide, we're going to have to capitalize on the explosion in medical tourism worldwide, where people are willing to travel for healthcare they can't get locally. And where we're out here is we're right near Yellowstone, Jackson Hole, Wyoming, Sun Valley, Idaho, Salt Lake City, beautiful mountains, Snake River going down. And so prior to COVID, people would come see us once a year. We'd have to see them in person for the first visit. And then once a year, they come until we get them doing really great. And then when COVID hit, one of the things that came out of it was telehealth. And so now 80% of what we do is telehealth. People are willing to travel to get healthcare they couldn't, but now they don't even have to travel. But we're seeing people from all around the world, every state in the U.S., our patients are within 18 different time zones around the world. And we're really trying to educate people that there is a way to prevent these things. There is a way to reverse them when they get there. And it's not the medications that are quite problematic that most people think it might be their only option.
Yeah. So just to backtrack, you did your medical degree. You went into spinal injuries. What was your role in spine? Were you a surgeon?
No, I was the rehabilitation doctor.
Okay.
So I was one that would, after, they had the trauma surgery or whatever, well, now we got to teach them how to live their life and be functional, even if their, impairment is paralyzed with neck down, waist down. And I started a lot of a big sports and recreation program for people with all kinds of chronic issues. I was a team doctor for the United States wheelchair basketball team when they won the World Championships in Sydney in '98. And but they had such unique health needs and were so sensitive to medication, something that you and I would get, at a local drugstore for a sinus congestion, not even think twice about it, could kill them. And so we were really forced to be creative and find solutions that there just wasn't hardly many solutions. And sure enough, what I originally found was acupuncture, because acupuncture seemed to be something that could help just about anything. Nobody was doing it. And so I trained out of UCLA in acupuncture, and oh my gosh, it was so fantastic. It really got me down this pathway of, okay, so what is out there that I was never taught in my traditional training? Because here's acupuncture that I never even mentioned during my traditional training that worked fabulous for so many different health issues. And sure enough, a couple decades later, there is a lot of information out there about how to help people with chronic health issues reverse what they got, prevent new stuff, but also ideally, starting early enough in life, like in children or even before somebody conceives a child, you can put things in place so that you're preventing disease not only in their children, but actually the next 6 to 8 generations through epigenetics.
So how long had you been a doctor before you, well, I guess from what you were saying, the trigger, if you like, was when your son was unwell. How long had you been a doctor by that point?
Oh, I'm an extremely old man now. And that was about 26 years ago. So that was probably about 25 years ago, almost 22, 23 years ago when he had that. And I'd already been practicing integrative medicine, even prior to that, practicing acupuncture. So I was working in a large teaching hospital near Chicago, and I was doing about 100 acupuncture treatments a week for a good decade, seeing everything you can possibly imagine. And when he got sick, the acupuncture almost always works. Didn't work. All the traditional stuff didn't work. I knew every integrative practitioner in Chicago, everything you can imagine, herbal medicine, energetic medicine, homeopathy. Boy, nothing was working. And then that's when I had no choice to figure out myself what was going on. Unfortunately, even back then, there was so much information about what will drive chronic health issues and what you can do to reverse them that he did great, but it got me on a path.
Well, it's interesting, all these things that come along and challenge us, they kind of force us to learn and grow, don't they?
Absolutely.
Yeah. I mean, normally my discussions on this podcast is that, and the same with myself, is that the people that I speak to went through the issue themselves. But in this instance, it was your son that gave you that motivation to look deeper, so to speak.
Mm-hmm. Absolutely.
Interesting. So obviously you'd studied acupuncture. You were already using integrative medicine to a degree. What was the first kind of area that you started to research when your son was ill?
So that's where I started to find functional medicine. And I found it very interesting because with acupuncture, you're always looking for the central mechanisms. And so you may have 10 people come in with a chief complaint of low back pain, but you can't treat them all the same because every person is unique. And so, yes, each one of these 10 people's chief complaint would be low back pain, but one person would have low back pain and asthma, low back pain, irritable bowel syndrome, low back pain and psoriasis, low back pain and brain fog. And so you had to find the central mechanism. And so you did the acupuncture uniquely for each individual, but everybody got better at the same time. But also, because you were getting at these central mechanisms, you were able to turn all their symptoms around at the same time. So even though we might do a first acupuncture treatment, they come back next time, I ask them, so is your low back pain any better? Nope, exactly the same. And I know it's okay. So it's an 8 out of 10 average. It'll get up to a 10 out of 10 3 times a day, goes down your legs 3 times a day. Yep, all the same. If I go, well, you also told me that you don't poop more than once a week. What's your pooping been like? Oh my gosh, I had a bowel movement every day this week. Holy cow. You say you wake up 5 times a night to go to the bathroom. Oh my gosh. I think I woke up once all week to go to the bathroom. Oh my gosh. And I go, oh, we hit the central mechanism. We're getting all this stuff changed. It's just a matter of time before the low back pain starts to get better. So functional medicine is really looking at the root cause of what's driving the chronic health issues, so that not only can you get at why they have their main thing, but you're getting at why everything else is going on, because everything is so connected. And so you're reversing everything at the same time. So that spoke to me because that's how acupuncture worked. Now, acupuncture, there was a big leap of faith where they'd come in, they weren't real familiar with acupuncture. They kind of heard some about it. They maybe never knew anybody that ever had it. And there's this leap of faith where I'm going to put some needles in you and I'm going to make you better. Well, the way that medicine works typically is, oh, you have a health issue. Let's run some tests. Okay, let's do some blood work or something like that. Well, then when I was doing functional medicine, I go, okay, we should be able to get this. Let's do some blood work. And I kind of spoke to him like, oh, well, that's what all doctors do. And then I said, okay, now then we're going to interpret the labs, and that's going to tell us what's going on and what we got to do. So it really kind of spoke to sort of the mindset of patients. It wasn't this huge leap of faith. It was, oh, they do labs. They'll use that information to figure out what's going on. But what we would then do is use that information not so much to go, okay, here's this medicine to put a bandage on one symptom. And if you need another bandage, medicine for another symptom, we'll do that. And we'll get you 10 or 12 medicines going. Well, none of them is really going to fix the thing, but we'll kind of get you through your day. But you're going to keep getting new stuff because we're not fixing why. Well, here's functional medicine. You get at this central mechanism, you're in a position to put them to fixing everything at the same time, which is exactly what we would be, ideally trying to do with acupuncture. So it kind of had that same mindset for me, but it kind of spoke to more the expectations of patients in the typical setting.
Yeah, that makes complete sense. That you're not having to change their complete paradigm of your approach. That's kind of what they're used to, but you're actually doing something completely different. But it seems very
completely.
It seems very similar to what they've had before.
Yes, exactly.
Gotcha. Now, one thing I think most people are starting to become more and more aware of the importance is the gut. So why is it that disruption to the gut is playing a part in just about everything that drives autoimmunity and chronic disease?
Well, the gut really is the central mechanism in everything. And during embryology, as the fetus is developing, the very first part is the gut, basically the nervous system of the gut and the immune system that surrounds the gut. So even in embryology, it's the gut, immune system, nervous system of the gut that then drives the development of all the other body parts, making sure they're where they're supposed to be and all this kind of stuff. And so it communicates with every body part. And so when you look at the root cause of autoimmune disease and chronic disease, the gut is part of everyone. So the gut is off, you're not going to be digesting your food, you're going to get vitamin deficiencies. Your gut's off, you can't balance hormones. Hormones gets all out of whack. You get gut issues, 80% of the immune system surrounds the gut, well, you're going to get immune system disruption. Your gut, by pooping, is the main way to get rid of toxins from the body. There's some toxins we can breathe out and sweat out and pee out. Mostly got to poop them out. Well, if you got a disrupted gut, you're not getting rid of toxins, and they're building in your system over time. And then when all of that stuff, and when the gut's off, it gets leaky. That intestinal permeability starts driving food sensitivities. And here's all these foods that can bug you in an obvious way or a sneaky way. But then when all this is going on, it's creating so much stress and duress to the system, it's going to throw the stress hormone cortisol off. And then when cortisol gets thrown off, stress always whacks the gut. And so here's cortisol getting stuck in the stress mode, whacking the gut, throwing everything else off. And so this is where, you really got to focus on the gut. Now, of course, you want to focus on all the root causes, but the gut is such a central mechanism. If you get it going the right direction, now you're going to start getting everything else going in the right direction. And then once you get everything where you want it, that gut and 80% of the immune system surrounding the gut, that's your foundation that you want to lock in place So then you're doing your due diligence to, prevent people from getting new things down the line, like cancers and Alzheimer's and heart attacks and strokes and all that kind of stuff.
Yeah, it's absolutely key. I mean, one of the things that I try to explain to clients is, if you think of your skin, it's there to protect you against the environment. And, to a degree, I mean, yes, obviously we can absorb stuff through our skin, but where do we absorb our nutrients? It's in the gut, right? So it makes sense that the majority of our immune system is in the gut. It's the place where we are actually absorbing things from the outside world. And what I'm trying to explain to people is, once you've put something in your mouth and swallowed it, it's not technically in your body. It's in the tube that runs through your body, but it's not actually in your body. But obviously, once something is absorbed through the gut lining, now it's in your body. Now it can access your bloodstream. And I think that kind of helps people to understand why it's so important to really look after your gut, because, as you said, that's the center of everything.
Yeah, and that's kind of why gastrointestinal tissue is so similar to skin tissue in a lot of ways, and what will throw off the skin throws off the gut, because basically those are the barriers that keep us separated from the outside world. And technically, even though the gut's sort of inside of us, it's open on both ends, so technically it's not really inside of us, it's connected to the outside world, just like the skin is.
Yeah, I mean, what's the gut lining often called? The intestinal barrier, right? And what is the skin? It's a barrier to the outside world. To me, it kind of does the same thing. I mean, the gut's probably a bit more complex because obviously it has to allow nutrients through the tight junctions, but it pretty much does the same thing. It helps protect us from things that we don't want to get inside our body.
Yeah, the body has to be very selective, let things in. And boy, is that complicated. Letting things in that we need while keeping things out that we don't need. It is a job.
Yeah, and just looking at it from a very basic level, what is the immune system? The immune system is there to identify anything that shouldn't be in the body. And when it does identify it, what does it do? It attacks it. Right? So
yeah, and that's where the body is so challenging, because like when food comes in, food proteins, well, the body has to decide whether that's friend or foe. And it's not as easy as it might sound. Here's a bad bug, like a bacteria or a virus that gets in. Well, the immune system got to decide if that's friend or foe. But the immune system gets a bit confused because the food proteins can be so similar to our body part proteins that this is kind of what they call like molecular mimicry. And it works either for the proteins on bad bugs or the proteins in foods, where this bug gets in, it's got a protein, and the immune system goes, oh, okay, I think that might be our foe. But, I see a very similar protein on the thyroid. So maybe that's our enemy too. So I'm going to start attacking it. And then here you get, Hashimoto's autoimmune thyroid, or food is very similar to the proteins on the receptors for folic acid in the nervous system. The body gets confused, attacks these folic acid receptors, and here's the autoimmune disease that accounts for 70% of all autism. So this molecular mimicry is a really a big driver of autoimmune, but it really highlights how challenging it is for the body. Bazillion times a day, it's got to decide whether something's friend or foe. What am I going to do with this protein that got in?
Yeah, I'm familiar with gluten and synovial fluid being seen as very similar in the body. And if someone has gluten sensitivity, how that can manifest as joint pain for that exact reason.
Mm-hmm. Yeah.
I mean, I've actually told the story before, and it's probably not complete. It's not gluten exactly related, although you might tell me it is. But about 4 years ago, a little over 4 years ago, I started re-eating oats. I hadn't eaten oats for probably 20 years at that point. And what I didn't realize around the same time, I started to get knee pain. So I play a lot of tennis. I work out in the gym quite a lot. I wasn't having problems in the gym. I was having problems in playing tennis. And my left knee, I thought I'd maybe damaged my medial collateral ligament. It might be my medial meniscus, or maybe my anterior cruciate ligament. And this went on and on and on. And I just kept thinking, it's going to go away. It's going to go away. It's going to go away. And eventually I was with a friend of mine, and I said, you couldn't just, run some, he's an osteopath. So I can just do some tests on my knee because I can't test it myself, and see what you think. And he did all the tests for, anterior cruciate, medial collateral, medial meniscus. And he said, no, he said, you got osteoarthritis in your knee. I said, okay, that's interesting. And I could only get about 90 degrees of flexion in my knee. And I thought, okay. And again, I didn't really think too much of it at the time. And then about 2 months later, I just said to myself, I'm going to stop eating oats. And within 3 weeks, my knee was completely pain-free.
Isn't that great? Wow, that's an excellent story.
I wish I'd cottoned on a bit quicker, but
well, and kind of to your point there, I was a tennis player too. I played tennis in college and all this kind of stuff. And so you're like, well, you're running around on a hard surface. You're going to get knee stuff eventually, arthritis. So you would kind of think, well, that's just how it is. But because you kind of dove a little deeper, you're like, oh, well, that actually isn't what it is. Even though it kind of makes sense that you would get that, it wasn't that at all. It was actually the food. Yeah.
Yeah. And again, the reason I brought that up again, could that have been some sort of, molecular mimicry that my immune system's thinking, these oats shouldn't be in there. I need to be attacking this. Interesting. It's interesting.
It's also a good example of how good the body is to heal. Is that with this going on for a while, within 3 weeks, it's gone. Your body's like, hey, I can fix this. Just give me a chance. All you got to do is give me a chance. I got you covered. Yeah. You got rid of the oats. The body's like, all right, here's my chance.
Yeah, and the pain went, but also my range of motion went back to completely normal within 3 weeks. So
that's great.
Instead of just being able to flex my knee to 90 degrees, I could grab my ankle and just pull it all the way back to my backside. No resistance at all.
I'm sure your tennis game benefited from that.
Well, he did. Yeah. I mean, the main issue I had is there was a lot of psychological guarding of the knee. So if someone hit a ball and I had to really try to run it down, my brain would just say, just don't bother.
Oh, the darn brain. Yeah. It kind of complicates things.
But again, it's very clever, isn't it? It's saying, well, yeah, you go for it and you're more likely to do yourself more damage. So as soon as that healed, I was able to run down more balls again. So yeah, definitely did make a big difference to my game. Now I think of it.
And this is where, people tend to think, oh, I have these health issues. It's got to be something. Something's causing this inflammation. It's got to be something, but I know it's not what I'm eating because nothing makes me feel sick. Well, foods may not make you feel sick the obvious way, that immediate hypersensitivity reaction where every time you eat something fast enough and dramatically enough, you don't feel well, kind of like kids with peanut allergies where, it doesn't take a rocket scientist to figure out, hey, kid, you probably shouldn't eat that peanut again when you had to go to the emergency room, throat's closing up. But then with the delayed hypersensitivity reactions where the proteins will whack you, create inflammation days later up to a month later, every time you eat it, it whacks you, but in a delayed way. And then because you don't know it, the inflammation just builds as time goes on. People go, geez, it can't be foods because nothing makes me feel sick. Yeah. Well, the food's making you sick the sneaky way, this delayed hypersensitivity, which is, something that gets missed so much. Now, I like that more and more practitioners are thinking about the delayed hypersensitivity reactions and asking people to test for that. But that's still one that in the U.S. and more traditional medicine, they, if you really want to get a heated battle going on with some more traditional docs, they'll tell you that that's not a thing. But then the data is so compelling, including like 15% of people worldwide have irritable bowel syndrome, notoriously hard to treat. Well, the data is really clear that if you eat clean based on the results of a delayed hypersensitivity food sensitivity panel, the IgG panels, 40% better in 4 weeks, 80% better in 8 weeks. Yeah. Turns out it's actually really easy to treat. And the data is clear, even though, unfortunately, still a lot of people out there just don't know the data.
Yeah, it's interesting. It's interesting that you bring that up because the last couple of guests on the show, so they're different episodes. They both worked for the same Premier League soccer team in the UK, and they kind of worked together. But one of them came in and worked specifically with one of these players, and he came in as an osteopath. So he's given that label by the team doctor. And he ran a lot of assessments on the player, physical, nutritional, mental, emotional, you name it. And it was very clear that this player, who was, an international player worth millions and millions of pounds, his injury was being caused by a gluten sensitivity. And when he put the report into the team doctor told him, first of all, you're an osteopath, you're not a dietitian, so what are you doing recommending things like that? And then he said, and by the way, elite athletes can't live without gluten.
Oh my goodness gracious.
Of one of the most successful English soccer teams.
I think Novak Djokovic in the tennis world would have something to say about that too, because he always would be the one that couldn't finish a match. He'd poop out, and the other guys would beat him towards the end. If they could hang in there to the fifth set, they knew he would lose it, right? So then he went gluten-free, did some other things, and initially I remember the announcers going, "Oh yeah, he's going to go gluten-free," and ha ha ha, and then now he can for a decade probably now, he can outlast anybody else on the court. If he can get to the fifth set, he's got you, because you're not going to be able to hang in there as long as he is. And he figured out that he had that gluten sensitivity too.
Yeah, he's a really interesting story, because obviously he grew up in a war zone, first of all, in Serbia. Mm-hmm. And his parents owned a pizza parlor. So he grew up on pizza. And,
is that right?
And ironically, it turned out he was sensitive to gluten and dairy.
Wow.
It's amazing, isn't it?
Wow, I hadn't heard that. That was fascinating.
Yeah, he's actually got a really good book. It's called Serving to Win, but it's mainly about nutrition. It's quite old. I think he's changed slightly in terms of his nutritional intake, but it's a really, really good book. And when I read it, it was almost like, it almost felt to me like he came to someone like me for advice, because it's exactly what I would tell people to do. It was amazing. But the other thing I remember at the time, when he was, whenever he'd play in a hot environment, like you said, he would always, he'd always have to stop playing because he just kind of overheated. And when you think about it, when you're stimulating your immune system, what comes with that? Well, it's normally heat and inflammation and possibly pain, mm-hmm. right? So if his immune system's overworking, it's creating heat in the body, and he's playing in very high temperatures already, well, no wonder he was overheating.
Yep.
And then
he's got that underlying baseline of inflammation all over. Yeah.
And then I remember the first year he played after he cut gluten out was 2011, and he won everything. And I never forget him playing Andy Murray in the Australian Open final. And I thought Andy Murray played unbelievable. And Andy Murray was playing shots. And you just naturally think, right, Djokovic is going to hit a defensive shot off this. And he was hitting winners off of Andy Murray's most aggressive shots. And it was just like, wow, this guy's a freak. It was just absolutely amazing to watch. Absolutely amazing. And to think, 12 years later, he's still at the absolute top of the game is just incredible.
I know. I think that everybody should use that as a kind of a measuring stick of how healthy the body can be when you kind of figure this all out. But, his life and his career would have been so much different if he hadn't figured it out. But this is really kind of the story about everybody with chronic health issues. You could be this healthy if you could figure it out. These health issues just don't come from no place. And so often we hear people like, of course, in their 40s and 50s, they come in and we start talking. They go, well, I just think I'm getting old. And I'm like, no. But we get people in their 20s coming in. Well, I think I'm getting old. No, it's not age. It's always something. But we always kind of tell people, well, it's not age until at least 90. Yeah. But now, as we learn so much more about longevity, the human body is probably designed to live over 100 as long as everything works as it should.
Yeah, well, I turn 55 next week. Well, by the time this episode is out, I'll be 55, and I've not started slowing down on the tennis court yet. There's no, I'm not any less capable physically on a court than I was 20 years ago. The only difference is it takes longer to recover. That's the only difference. And I'm determined to be able to do that in another 15 years' time as well.
Well, maybe we should start playing some doubles. I tell my friends who are still playing, I do a lot of snowboarding and all this for a bunch of years. But I tell them I'm saving my shoulder till the over 90s.
Right.
Okay, I'll have a fresh shoulder when we get to the over 90s doubles. We'll take over the world in the over the 90s doubles division.
Awesome. So something that I think people like us have been aware of it for a long time, but in 2020 we knew what was going on in the world. Something that was spoken about a lot was vitamin D. Can you explain kind of what it is, what it does, why it's important, but also why vitamin D receptor sensitivity in the gut is such an important factor to address?
Yeah, and this is one thing that tends to get missed. So vitamin D is more of a hormone than a vitamin. So it's a little bit misnamed. But hormones in general, they keep away inflammation. And by doing that, they keep away disease. And so with vitamin D, every cell in our body has a receptor for vitamin D because every cell in the body needs vitamin D to function optimally. Now, we've become very bad at making vitamin D from sun exposure. So ideally, when we run labs here, we want people's vitamin D levels to be between 70 and 90. And lifeguards in San Diego, California, are in the mid-40s. And they got great tans. They're on the beach all day long. In San Diego, way far south of us here, they're like 40 points lower than they should be. So it's really hard. So unless somebody's on the right dose of vitamin D supplementation, they are tanked and their bodies are feeling it in a bad way. And so you have to have vitamin D just right. And there's ever so many studies out there. If you go through PubMed, which is kind of the Google search engine for scientific stuff, I think I maybe started lecturing about this like 7-8 years ago. There's over 11,000 references to vitamin D. And there's so much data about this. But we have to have receptors on our cells for the things the cells need. And so you hear a lot about like insulin resistance, where the pancreas might be making insulin to control blood sugar. Every cell in your body has receptors for insulin, but those insulin receptors can become resistant to insulin. Insulin can't attach and do the work. It's almost like you don't have insulin, blood sugar goes up, move towards diabetes. So vitamin D receptors can become resistant too, but what we have figured out is that there's more vitamin D receptors in the gut than any other body part. And when the researchers figured that out, they were thinking, well, wow, this must mean that vitamin D is really important for gut health. Well, it turns out those vitamin D receptors can become resistant to vitamin D. And then it's almost like you don't even have vitamin D. You can have all the vitamin D in the world, it can't attach and do the work. And so what tends to happen in the gut is it disrupts the intestinal microbiome. So you start losing the good bugs, the ones fighting your battles, start building the bad. The lining of the gut will actually start creating inflammation, such as increased production of a really nasty bugger called NF-kappa beta. It creates all this the gut is actually making inflammation to destroy itself. And this is where you kind of hear this term where the gut can become the engine of inflammation throughout the entire body. But then the lining of the gut also stops making proteins designed to keep bad bugs down in the gut called antimicrobial peptides, AMPs. So then they get a chance to rise. And it's such a huge central mechanism for everything. So back in about 2018, they figured, hey, if you can fix this vitamin D receptor resistance, optimizes up intestinal microbiome, lining of the gut stops making inflammation, lining of the gut starts making the antimicrobial peptides, keeps the bad bugs down. Wow, that is a central mechanism in gut health. But what it turns out is it's actually the central mechanism in like everything. And so the original data was like, wow, this seems to be so profound. Not only is this exactly what you want to do to turn around ulcerative colitis and Crohn's disease, the autoimmune diseases of the gut, recurrent C. diff infections, recurrent H. pylori infections of the gut, which are notoriously hard to get rid of. But they go, oh, this kind of looks like what you want to do for about everything else. It probably works for cancer prevention, heart attack, stroke, diabetes, all this kind of stuff. Well, the exact same researcher 6 months later published this huge article calling correcting the vitamin D receptor resistance in the gut is a nuclear weapon, quote unquote, in the title of the article, nuclear weapon against diabetes, against metabolic syndrome. So you can turn around and prevent diabetes from this. But then all these subsequent articles since that time have said, oh, well, yeah, if you can correct the gut this way, like the Harvard Journal of Psychiatry about 2 years ago goes, hey, when you can fix the intestinal microbiome this way, and I'm like, oh, well, that's fixing the vitamin D receptor, you can treat major depressive disorder. And another article came out, well, if you can get the intestinal microbiome to do this, I go, well, that's fixing the vitamin D receptor resistance. It changes personalities. People become more outgoing, more social. So it has this huge impact on brain chemistry. But what you got to do is a combination of three things. There's daily vitamin D, daily probiotic, and daily butyrate. Now, most people out there know, hey, vitamin D, probiotics, but they may not be familiar with butyrate. So butyrate is a short-chain fatty acid made by the good bacteria in the gut. I think we could probably have 20 podcasts on the things that the good bacteria make for the body and the brain, but the butyrate's one. So it's profoundly important to keep away gut inflammation. So if you're low on butyrate production in the gut, you have increased risk of colon cancer. Well, it turns out this butyrate, as you would expect, the body is such a good multitasker. It's not going to make one thing to do one job. It makes one thing to do like 100 jobs. So it prevents cancer 5 ways. It treats cancer 5 ways. It is great for lungs. So children with cystic fibrosis helps them clear their lungs, helps brains recover after strokes. It does this, it does that. Oh my gosh, this butyrate is so cool. And then if you combine it with the other two, you can fix this vitamin D receptor resistance in the gut. But then that's where the good bacteria now, because now you got your numbers up, they actually start making the butyrate all by themselves. And then you're making this thing to kind of prevent every chronic health issue. But this is where this it really gets missed when it comes to reversing chronic diseases, this vitamin D receptor resistance that is not necessarily hard to fix, but most people don't know what a huge central mechanism it is. And if you think about, wow, fixing the vitamin D receptor resistance fixes insulin resistance, you're like, well, that's so cool. That is a central mechanism why people get insulin resistance in the first place. But then when you're talking about all this other kind of stuff, like you're clearing major depressive disorder, you're like, well, maybe we've got a situation where when the vitamin D receptors become resistant, it causes all receptors in the body to become resistant, not just insulin. So maybe serotonin receptors, the feel-good neurotransmitter serotonin, maybe it can't attach and do its work. You fix the vitamin D receptor resistance, maybe serotonin receptors become more sensitive. Serotonin attaches. You clear major depressive disorder, but that would be the same thing for receptors for the calming neurotransmitter GABA. You name it. Now the receptors are awake. Now the thing the body makes can actually do its work, and that might be one of the central mechanisms that allows that to kind of fix everything at the same time.
Yeah, that's really interesting. Do you know what it is that causes the receptors to become insensitive?
Well, there's ever so many things that just whack the gut. Stress always whacks the gut. Antibiotics whack the gut. Oral estrogens like birth control pills will do it. The Motrins and the Advils, all the NSAIDs will do it. Unfortunately, a medicine that gets used a lot for blood sugar control doesn't work very well, but is common is one called metformin. Creates a lot of intestinal permeability disorder, including it throws off epigenetics, which is a story. So it's ever so many things that kind of whack the gut, and then the gut gets whacked, being the central mechanism. Everything suffers because of it.
Yeah, that's interesting, considering I was prescribed antibiotics for 18 years for acne. I've not been on them for a long time now, but it's almost frightening to think what that did to my gut microbiome all over those years, and it wasn't even helping with my acne, which makes it seem even more silly that I continued taking it even though it wasn't working.
And that's where the antibiotics, you'd like to think that we're getting away from this. So like actually studies out of England back in the 80s said that for children, 95% of the time when they have an ear infection, no matter how bad it is, no matter how bad it looks on exam, no matter how bad they're crying, 95% of the time, the antibiotics aren't going to help it get better any quicker than if you just let it run its course. But, kind of like, well, you want to give the parents something for a screaming child. Yeah. But boy, that's a tough one, especially because at young enough ages, and this is a big driver of autoimmune disease, is this early gut disruption where even one dose of an antibiotic at young enough ages will totally disrupt the intestinal microbiome, and it won't correct unless you help it. So it's not even a full 7-day course, 5-day course. If you're 0 to 3 months is the worst, 3 to 6 months is second worst, 6 to 12 months is the next worst. But even one dose of an antibiotic at those young ages totally throws out the intestinal microbiome. And then you just see this thing just keep rolling along, just getting worse and worse and worse as time goes on until, oh, by the way, you got autoimmune disease. By the way, you got childhood leukemia. By the way, you got all this other not nice stuff.
Well, that's interesting for me because I actually had life-saving surgery when I was 6 weeks old. So I was born with pyloric stenosis. So I had to have life-saving surgery. So I'm pretty sure I would have had antibiotics at 6 weeks of age.
Yeah.
Which, when you look at the whole story, I was hospitalized with gastroenteritis age 2. Then I had acne from age 13. Obviously took antibiotics for all that time. So, the last 23 years or so has been it's been a challenge, let's say, to try and reclaim my gut microbiome. I mean, it's not terrible, but it's not probably as good as it should be. But then again, without the surgery, I wouldn't be here at all. So,
Absolutely. And that's where, if you got to do something, we kind of talk about, in a perfect world, you may not want to do this medication or something, but, you got to do what you got to do. But what we'd like to do is make sure that if you do something, well, let's make sure you get the upside, the benefit without the downside. Whether it's you need this medicine long term, for something, well, fine. But let's make sure there's no downside from that medicine. All you got to do the surgery, well, great. Well, let's make sure we try to make sure you get all the benefit without any of the downside.
So just going back to the vitamin D receptor sensitivity, the key things you were saying, daily vitamin D, daily probiotic, daily butyrate. Is there any recommendations because obviously there's different types of vitamin D you can get, different probiotics. Any advice on types or even dosages? Holly was a 28-year-old personal trainer suffering from acne when she first came to see me. Holly had terrible breakouts and felt embarrassed and like a fraud when training her clients, as she didn't think she was the perfect example of what it meant to be healthy. Even though she was a personal trainer and was trained in nutrition, she didn't realize the food that she ate caused her acne and affected her overall health. Following a few lab tests, it was discovered that Holly had fungal and parasite infections, as well as food sensitivities to gluten, egg, and soy. Holly changed her diet as advised, followed her metabolic typing diet, eliminated sensitive foods, and followed a plan to reduce her fungal and parasite infections to help heal her gut. The program worked to treat for Holly, and she was completely spot-free relatively quickly once the program was in full flow. She now has much more confidence, especially at work, enjoys her social life, and no longer has to wear makeup to go out of the house, which she really loves. If you would like to achieve the same kind of result as Holly, you can now follow a comprehensive step-by-step guide in my brand new book, Eliminating Adult Acne for Good, available now from all major online bookstores and via my website at www.bodycheck.co.uk/books.
Well, typically for vitamin D, most people are going to need between 5,000 and 10,000 IU per day to be good. Now, there are people that need 20,000 more. There are some people 2,000, but that's usually a good way. Now, we kind of say, well, if you're going to start on a dose, go ahead and start on a reasonable dose, 5 to 10,000. If you can, check your levels in 8 to 12 weeks. If you need to go up, well, 1,000 IU per day on average increase will take you up about 10 points. Or if you overshoot, drop down 1,000 for every 10 points you want to drop down. And then we usually alternate probiotics every 3 months. We kind of like to alternate between live probiotics and the spore-based probiotics. And the spore-based probiotics are very interesting because if you can get enough of one good bacteria in the gut, it's like a domino effect. All the other ones build too. One of the challenges with the live probiotics when you take them by mouth is the stomach acid tends to dissolve them. So you want to use, 50 billion, 30 billion. So in the hopes that enough gets past the stomach acid unkilled, that they get down there and then their numbers build, domino effect. The spore-based probiotics, spores are so interesting because you kind of look at it, I look at it like kind of the difference between like a seed and a spore. So here's a seed, a live thing, but if the conditions aren't right, it'll die. Well, here's a spore. It'll just sit there until the conditions are right. So like you may have a spore in the desert. It'll wait 40 years for that one-time rain, and then it'll bloom. Well, then here's the spore-based probiotics. They're not going to open up in your stomach where the hydrochloric acid is. They're going to wait till they get to the conducive environment for their growth in the intestine, and then they bloom big, totally undisrupted because of the stomach acid. But then you get this amazing domino effect. So this is why we like to alternate back and forth. And then on the butyrate, there's butyrate cal mag. So they connect a little bit of calcium magnesium to it. For kids, we usually do 1 twice a day for the autoimmune stuff, or chronic disease in general. And then the adults usually 2 twice a day, though the butyrate is kind of stinky. Butyrate is short for butyric acid, so it's an acid, so it's kind of stinky. So on kids where they may be so young that the stinkiness bothers them, but they can't even swallow capsules yet, well, we just say, well, open the capsules, mix it with food and that kind of stuff, whether it's vitamin D, probiotics, whatever. The butyrate cal mag is too stinky, but then we tend to use sodium butyrate. So when you pair an acid with a base, sodium being a base, it takes away a lot of that smell, and then you can mix it in food, or if you're an adult and it tends to be a little offensive, you go to the sodium butyrate as well.
Gotcha.
And then ideally, once you feel great, then we usually say, okay, well, keep the vitamin D going, because you're just going to tank if you don't take it because it's so hard to make it. But then you may not even need the butyrate. Maybe take a probiotic once a week, kind of help maintain the gut health long term. Of course, manage stress, because stress is so tough on the gut, that kind of a thing. But it's not like you necessarily need these interventions long term, because once the body has it fixed, the body really takes over and does most of the work. So most of the supplements that we would maybe use to reverse chronic disease and autoimmune disease, they're all temporary.
And in terms of vitamin D, would you recommend higher doses in the winter?
Well, there's probably a little bit of a drop in the winter, but people are so terrible at making vitamin D from sun exposure, even in the summer times. Usually you're going to be on pretty much the same dose year round, though your level may go up 3 to 5 points in the summer, but it's not super significant. Yeah, so it's kind of all year round.
Okay, gotcha. Yeah, it's interesting because I do cycle my probiotics, so it's quite interesting to hear you say that as well.
You're talking about tennis and sports, and they did an interesting study. So back in the day when East Germany and Russia, before the wall fell, those athletes were really kicking the butts of the people in the Western Hemisphere, kind of a thing, and in Europe, and everybody thought it was steroids. Well, it turns out they started noticing their athletic performance started to wane about in the fall. And they thought that was very interesting because in East Germany and parts of Russia where they trained, the summers were so hot that the fall would be the best time to perform outdoors, but their performance started to wane. And then they go, oh, vitamin D levels are going down because the sun's starting to go in the southern hemisphere. They started supplementing vitamin D, and that was one of the reasons they were kicking butt. So at the University of Illinois, my medical school alma mater in Chicago campus, 1978, they ran this study because the word started getting out, and they took all these really high-level athletes around the Chicago area. They brought them to the University of Illinois for essentially training programs specifically for high-level athletes. Can we get you as a high-level athlete to perform better? So we're going to train you. Well, half of them, besides the training, got vitamin D supplementation to get them ideal. So the ones that had this high-level training, they increased their performance by about 3%, which if you're competing against another high-level athlete, that could be very significant, right? Cross-country runner, that could be the difference between first and seventh or something like that. The ones that got the training and the vitamin D, 20% improvement in athletic performance. And they're like, holy cow, this is like steroids. And so way back then, they kind of figured out that, wow, this vitamin D is so important for athletic performance. But when you're kind of talking about the health of non-athletes, what you really want is high performance. Whether it's, walking up and down stairs, picking up the grandchild, doing your other stuff, everybody wants high level performance. And this is where the vitamin D really helps not only high level athletes, but the performance of everybody part.
I wonder if vitamin D also makes the steroids work better as well.
It seems to do about everything, so I wouldn't doubt it. Well, that's the kind of thing I think you were talking about, the inflammation. It's like, well, if you got a body that's really healthy and you give it something to make it perform better, it's going to perform better than if you're starting with a terrible body. Same thing with the inflammation, though. If you're starting with a high level of inflammation, it doesn't take much more inflammation on top of it to totally whack the system, like with Djokovic cases, so, yeah.
And the other thing as well, if athletes were taking steroids, and we know the East Germans and Russians, we know they were using steroids. One of the things, obviously, they do is they allow more volume of training, right? That's one of the things that allows them. So if there's more volume of training, think what's that going to do to their joints? Or potentially, there's going to be more inflammation, right? So if they're taking vitamin D and it's helping with the inflammation, then that could help them as well, possibly.
Absolutely. Yeah, it totally makes sense.
So can you explain a little bit more about infections and how they drive chronic disease, including chronic pain, which, I have a specific subject, a specific interest in as well?
Yeah, this is another thing we find gets missed is there's infections that drive obvious infection. You get a high fever, you're like, oh, I got an infection, the cold, flu, COVID, that kind of stuff. There's other bad bugs that drive chronic disease. So these are the infections that get in with like this cloaking device. And when I talk to the people that are very familiar with the Harry Potter series of movies, there's the first one where Harry and Ron Weasley, they have the cloak of invisibility, and they're able to put over, they get into the library to look for the book. Well, it's kind of like these bad bugs that drive chronic disease have this cloak of invisibility. They get into the body and they hide from the immune system. So the immune system doesn't respond with a high fever, and all this kind of stuff. So they get in, they hide, but over time they're able to start creating inflammation, and it just builds over time, driving chronic disease. And we tend to know which ones these are, though. And we can test for them. So, of course, you can get chronic infections in the gut, and then that whacks everything. But you get chronic infections get in the bloodstream, go all over. Epstein-Barr virus is one of the ones that people maybe hear most about. But then the other ones that are quite common include herpes virus 6, Coxsackie viruses, mycoplasma, all the tick-borne diseases, and easily testable on a blood test. Now, they can be a little hard to find on a blood test. By the time we see people, they're usually so unhealthy that it's pretty easy to find them. We know they're there even before we test, of course. But if the bug is really good at hiding from the immune system on a blood test, we're kind of in our infancy on how we test for these things. We have to look for antibodies being produced by the immune system against this certain bug. And if you see antibodies against the bug that should never have gotten in your body in the first place, that bug is there driving the chronic disease. And we got to get rid of it. But if the bug can hide really well, you won't see antibodies anyway. So part of it is you got to know they're there, whether you find them or not. Now, Epstein-Barr virus is a little different because it gets in everybody. So everybody has some antibody production against Epstein-Barr virus. Trying to kind of keep it at bay, kind of make sure it never rears its ugly head. Because if it rears its ugly head, it drives chronic disease. Probably the first disease associated with Epstein-Barr virus was multiple sclerosis, for example, right? And so a couple of antibodies, no big deal. But what you see on blood tests is antibody production is so high against the Epstein-Barr virus, they can't even count that high. So whether somebody may have like 30 or 50, you go, nah, it got in at one point in your life, usually within a few months of age. You have a couple antibodies produced, but it's not an active infection. But when you see titers more than 600, you go, oh my gosh, there are so many antibodies being produced against this bug. You can't even count that high. Oh my gosh, is that a big fight? Your immune system against this bug. That bug is driving the system crazy. And so you got to get rid of it. And truly, this is like all chronic disease. So even like childhood leukemia is driven by Epstein-Barr virus and this herpes virus 6. But people kind of misinterpret that. They go, well, these are very common to be in humans. So when we find them in these kids with childhood leukemia, we don't find any unusual ones causing this disease. We just find the usual ones that are in most people. Mm-hmm. And we're like, yeah, because they're the usual ones that drive chronic disease, of course, right? And so they're in so many people. Now, you want a healthy immune system to keep these bugs quiet, dormant. Now, some of them, like herpes virus 6, mycoplasma, Coxsackie viruses, they should never get into the human body. You get rid of them as you reverse the chronic autoimmune disease, chronic disease, and then now hopefully your immune system is so healthy, it never lets them back in again. Other bugs are always going to be there, like Epstein-Barr virus. So you have to have a really healthy immune system to keep them dormant. So it's a little bit like shingles, where the virus that causes shingles gives chickenpox as a kid. Well, it lies dormant right outside the spine, dorsal root ganglia. You want a healthy immune system to keep that virus dormant your whole life. But when the immune system becomes disrupted, it can't do that, and it allows the virus to become active, and you get the shingles. Well, you don't want Epstein-Barr virus to get active. You don't want other bad bugs in body parts that are kind of hanging out to ever get active and drive chronic disease. So this is why it's so important to keep the immune system healthy. But when the immune system loses control, ones that are always in become active, or ones getting it from the outside, then a real key is to get rid of them. Now, because you're usually dealing with multiple infections at the same time. Once somebody's left the barn door open and a bad dude's gotten in the side door, it's a party. It's like 3, 4, 5. We find 6, 8 infections in people sometimes. You got to use something to get rid of all the infections, no matter where they're located, no matter what kind they are, whether you even know they're there or not. And so a really great broad spectrum antimicrobial that we use out of Canada is called pH structured silver solution. So it's a nano silver, so much different than colloidal silver. Nano silver can kill any bad bug. It's been shown to kill malaria. It dissolves biofilms, which is a big concern. Biofilms make it really hard to kill these dudes. They surround themselves. Antibiotics can't get through that. That's why you can't use antibiotics to get rid of this stuff. But then the structured water, I'm going to geek out a little bit on science here for just a moment. It has to do with the not the biochemistry of water molecules, but the biophysics of water molecules, where the structured water component to the pH structure silver solution gets rid of inflammation and helps damaged tissue heal. And it seems to do it through epigenetics, where you're flipping bad genes off and good genes off in every cell in the body. They did this great study on skin, because I know skin is a big topic for your podcast. So they were using it for burn injury patients, because they don't want the burn injury patients to get infections, because then they got to go debride and, oh my gosh. So they started seeing, though, that the burn injuries were healing faster with the pH structure silver solution above and beyond, oh, we're not getting infections. And they go, geez, why is that? So they did this beautiful study on the epigenetics of skin cell healing. So it turns out that skin cells have 88 different genes that code for skin cell healing. When you use the structured water, the pH structure silver solution, right, it actually makes more active 59 out of those 88 genes that code for skin cell healing. Most of them, their activity was doubled. One of them that has to do with sort of how skin issues can run in families, this genetic kind of skin stuff, upregulated 30 times more active in healing the skin cells. So the structured water works through epigenetics. Meditation works through epigenetics. Butyrate almost exclusively works through epigenetics. This amazing thing called TUDCA, which is a bile acid made by the liver, works almost exclusively through epigenetics. So if you can get these things that work through epigenetics, you're in a position to flip bad genes off and good genes on in every cell in the body at the same time. And this is where also we kind of wonder about this pH structure silver solution's impact on the gut, because the gut and the skin are so similar. If it does this for the skin, we're thinking it probably does it for the gut too. Yeah. Which is one reason why it's able to heal the gut so well, and why we don't tend to see Herxheimer's reactions when we use this broad spectrum antimicrobial, because when you're killing the bugs that drive chronic disease, there's such a die-off, toxins released as the bugs are dying. You want to kill them, but then people go, oh, I feel worse using this thing to kill this infection. Well, the toxins are released. It's irritating everything. And actually, a neat kind of side note is Dr. Herxheimer's from the 1880s. He was using mercury to kill syphilis. And he noticed that the mercury kills syphilis so profoundly, and the die-off is so profound, they can get a die-off reaction. Turns out, surprising, mercury is very important for killing all carbon-based organisms, not just syphilis, but humans. Very, very good at killing bugs. Yeah. But so many things get Herxheimer's reactions, but we don't see that with the pH structure silver solution because I think it's helping get rid of inflammation, help damaged tissue heal. So at the same time you're killing the bugs, you're healing the tissues, and you don't tend to get Herxheimer's reaction, even if you're got tons of different infections that are being killed at the same time.
Wow, that's really interesting. I'm certainly going to look into that because I've never used that myself or with clients before, so I'll definitely look into that, and hopefully they ship to the UK.
There's plant-based broad-spectrum antimicrobials, but we tend to get a lot of Herxheimer's with those. You have to start real low dose, work your way up, increase, and because that Herxheimer's can be a killer, but we don't tend to see that with the pH structure silver solution.
Interesting. That's very interesting. And again, it's really good to hear you talking about structure of water because that's something that I do as well. And I'll put in the show notes actually a link I use a wand. It's by a brand called Analemma. I'll put a link in the show notes for people that if they're interested, they can always get that to help restructure their water as well.
Oh my gosh, I'm speaking to a kindred spirit who likes to geek out on science. All right.
Awesome. You've called the hormone imbalance, estrogen dominance, the most dangerous disease in women. Can you explain why you say that?
Yeah, and this tends to go back to the gut once again. And so hormones are so important. I referenced earlier they keep away inflammation. By doing that, they keep away disease. We want to be able to make our hormones our whole life. Like, for example, estrogen, like in women, let's say, estrogen keeps away heart attacks and strokes, keeps away cataracts and macular degeneration, keeps away osteoporosis, keeps the gut healthy, keeps away fine lines, wrinkles in your skin. So you want to make this, even after the ovaries stop working at menopause, a woman still has to make estrogen a different way because you don't necessarily need a heart attack and stroke after menopause any more than you needed it before menopause. You just got to make it a different way. But the hormone symphony, the balance of all the hormones, is almost more important than the hormones individually themselves. So in women, a super common imbalance that drives chronic disease and immune system disruption is too much estrogen relative compared to progesterone, estrogen dominance. And so it drives all the hormonal menstrual things. It drives bad menstrual flows, bad cramps, premenstrual syndrome, ovarian cysts, PCOS, fibroids, endometriosis, fibrocystic breast disease, infertility, all that kind of stuff. And when you kind of look at that, you go, my gosh, how common is this? Especially nowadays, it's like almost like what woman doesn't have at least some of that. But also because estrogen revs and progesterone calms, it drives excessive worry, anxiety, insomnia, panic attacks. And that is also so common in women. So this estrogen dominance does all that, but it is such a big disruptor of the immune system. It's one of the big reasons why 80% of the people that get autoimmune disease are women. But cancer is the flip side of the same coin as autoimmune disease. So women that have estrogen dominance before menopause have a 5.4 times greater risk of getting breast cancer before menopause. Not twice the risk, not 3 times the risk, 5.4 times the risk of breast cancer, and a 10 times greater risk lifelong of malignant cancers, the ones that start one place and metastasize other places. So this is a huge driver of this immune system disruption, autoimmune disease and cancer, but also we now know that this autoimmune process, the immune system disruption, is such a big player in so many health issues that we didn't realize before. It's part of heart attacks, it's part of strokes, of course, it's part of cancer, it's part of Alzheimer's and dementia, it's part of all these kind of things. So if you look at the top 10 reasons why women die, this estrogen dominance is probably playing a part in every one of them, almost 90%, but the only one it's not really playing a part in is like accidental deaths, in car accidents and all this kind of stuff. So there's such a huge driver. Now, the interventions that tend to get used either miss an opportunity to turn this around before it ever becomes autoimmune disease cancer. So like if a woman has, let's say, sleep issues or anxiety issues, well, here's anxiety. Well, I can give you this medicine called Xanax, and Xanax will make you feel calmer. Well, you may be calmer, but of all the things that might be causing anxiety for a woman, the one thing is not causing anxiety is a Xanax deficiency. because a woman doesn't have Xanax in her body. It's got to be something. It's not that. Oh, what's the big deal? She's calm. Well, you had this opportunity to fix the estrogen dominance and create the calm, and she would be calm. But now you did your due diligence to prevent further disease later on. When it comes to the hormonal menstrual stuff, unfortunately, the major way those are dealt with is we'll just put you on birth control pills. And that'll stop the bad flows, the bad cramps. It's just kind of, well, basically they put a woman in menopause, right? So you don't have your flows, you don't make all so, but birth control pills, oral birth control pills are estrogen based. So you got this estrogen dominance, you're giving a woman estrogen, it's going to make it worse. And then when it gets bad enough, a woman might be told, oh, you need a hysterectomy, or you have ovarian cysts so bad you have to have an ovary come out. Well, any change in the anatomy down there, one ovary goes out, everything else stays. Two ovaries go, uterus stays. Uterus goes, ovary stay in. Any change in the anatomy there makes the estrogen dominance worse. And it keeps driving them to these terrible things. And so typically it does kind of go back to the gut because, well, we talked about how the gut gets disrupted, everything gets disrupted. It throws off the stress hormone cortisol. Cortisol gets kicked up in the stress mode. Well, cortisol is part of the same steroid hormone production cascade called the steroidogenic hormone production cascade. When cortisol gets kicked up, the very first hormone in this hormone cascade that gets depleted is progesterone. And so you start getting the hormonal menstrual things, the rev without calm thing. But then your gut's disrupted, you can't detox. And so you're making new healthy estrogens to keep away all this inflammation. But once the estrogen has been in the system for a while, they get dinged, they get beat up. Now they're becoming irritating and toxic to the system. You got to be able to run your detox pathways, dump the toxins into the gut, poof them in the toilet. Well, when you got the intestinal permeability disorder, they don't go in the toilet. They come right back in the bloodstream and build over time. So what you got, cortisol depletes progesterone, can't get rid of old toxic estrogens they build. Here's this estrogen dominance that drives not only autoimmune disease, huge risk of cancers, but also so much of chronic disease in women that we're really trying to educate people that when you see these hormonal menstrual things, you see this rev without calm stuff, this is our opportunity to fix the problem, to fix the root cause of the problem so that they get rid of it. They get rid of the hormonal stuff. They sleep like a baby. They're all chill. They're calm. And we've done our due diligence in preventing them from getting so many chronic disease as time goes on. Really the best way to prevent disease.
Yeah. So from what you were saying, the main thing that would cause estrogen dominance would be stress.
That gets the thing going for the progesterone drop. But then the gut disruption, maybe because of stress, creates the leaky gut, or the antibiotics, or the Motrins and Advils, or all these other things. Then that's the leaky gut part. And then here's estrogen that starts rising. Usually it's the kind of the double whammy. It's the estrogen is too high, the progesterone is too calm. But if you can get women soon enough, the progesterone might be fine. It might just be the high estrogen. And you can test this on an easy blood test. In women, you want to check it on day 19 to 21 of the cycle to see that balance. So it's an easy test. Anybody can do it. It's not that hard to fix, but it is profoundly important that people understand the significance of these rev without calm, hormonal menstrual things, and what is in the future that can be prevented simply by making the woman feel better the right way when she's having those things.
And when you say it's easily fixed, obviously that's assuming the person's willing to do the things that they need to do to put it right.
Well, that's true. And that would be assuming that a person's given the information that there's options besides the Xanax or the birth control pills. Yep. And that's part of the problem is that people don't know there's other options. They never do the other options. But that's why we're trying to, and thank you for educating everybody in your population with what you do, because you reach a bigger audience than I could ever reach probably. We give people the information. They know why this stuff happens. They know there's ways to change it. They're not going to just be satisfied with a bit of a bandage that temporarily makes them feel better, but then ultimately they just keep getting worse and worse.
Yeah. I guess the point I was trying to make, like, it can be taken the wrong way when you say it's easy to fix. because some people might think, well, I just need to take some pills and it's going to be all right. But quite often it requires a fair bit of lifestyle change, as well as, you might take some supplements, but it might be, dietary changes and, maybe not working so long hours, maybe going to bed a little bit earlier, maybe doing some meditation or some yoga, whatever it might be. So it's not just, oh, here's a pill, off you go, you'll be fixed. It's easy.
Well, I think all of those sound lovely. Yoga, getting to bed earlier, that sounds lovely.
Most of that's relatively inexpensive as well. Getting to bed on time doesn't cost anything.
It is. That is so true. That's right.
Simon suffered acne as a teenager and at the age of 21 began taking the antibiotic erythromycin. The erythromycin didn't work, and as a last resort, he took Accutane for 4 to 5 months. Whilst Simon had some good days on Accutane, he still had breakouts. Simon was constantly anxious whenever the inevitable would happen and his skin would break out. From the age of 23 to 25, Simon went back on erythromycin, and again, the results were disappointing. Simon came to see me at the age of 31 and immediately changed his diet, especially reducing foods that would spike his blood sugar. He introduced some essential supplements, started drinking more water, and reduced his alcohol intake to almost zero. A couple of months in, Simon reported that his skin was as good as it had been in a long time, and he has now experienced the longest spell without breakouts since he was a teenager. So Simon is no longer anxious about experiencing breakouts because he knows he's in control of how his skin looks via his lifestyle choices, which has been very liberating for him. If you would like to achieve the same kind of results as Simon, you can now follow a comprehensive step-by-step guide in my brand new book, Eliminating Adult Acne for Good, available now from all major online bookstores and via my website at www.bodycheck.co.uk/books. So something that you've mentioned already is epigenetics. So why is it important to understand epigenetics, specifically for parents and practitioners, to prevent autoimmune and all disease in general, in children and their future generations?
Yeah, thank you for asking this question. So we used to think that genes were hardwired. Kind of whatever we got, good, bad, otherwise, from parents or grandparents, we're kind of stuck with it. You kind of hope you got more good than bad. But what it turns out, it's not so much what genes you have, it's which ones get turned on and turned off. So there's a lot of bad genes, every cell in our body, got to turn them off. A lot of good ones got to turn them on. So this is where when they did the human genome, 10 years, 12 different major universities, they go, okay, we're going to sequence the human genome and we'll figure out the gene that causes every chronic disease. We'll go in and zap it, and then all disease will go away. Well, when they got the whole thing sequenced, they go, oh, well, that's interesting. It appears that there's some very, very rare things. 50 to 100 people in the world with this thing. It is a gene. We can go zap it. But most things are not what genes you have. It's which ones get turned on and turned off. And so this is where when you do things like you mentioned, like yoga, for example, or meditation, it works for just about everything at the same time because it's working through epigenetics. Harvard did a beautiful thing 15 years ago about that. And so the things that are worked through epigenetics tend to be able to fix kind of everything at the same time. So when somebody's not feeling well, they've got the bad ones turned on, the good ones turned off, but it's a good example of how you can get a whole bunch of stuff going wrong in the body at the same time because every cell is being told the wrong information at the same time. So you go, okay, so we know what drives chronic disease, disruption of epigenetics. So we talk about the 7 central mechanisms: the gut, the stress hormone cortisol, these invisible infections, foods bugging us, vitamin deficiencies, hormone imbalances, and then toxicity. So you start addressing those, you start flipping the right way. And you go, hey, I'm feeling better. Oh, I'm feeling a bunch better. I'm feeling really good. I'm feeling great. And then we lock people in place, and they just don't tend to get stuff as time goes on. Now, if you can do that at young enough ages, it's a lot easier, but then also you're preventing stuff. And so you ideally want to optimize epigenetics by age 19 so that you can set the system through the whole rest of life. So originally that was all physical stuff. We also see now that like adverse childhood events, childhood traumas, alter epigenetics, drive chronic disease. If you can get those genes flipped back the right way after childhood trauma by age 19, you're preventing all these chronic health issues. But if a parent can do that before they even become a parent, flip the mother, father the right way before conceiving a child, what they see is you've now set the system so well in yourself, you actually pass on cleaner genes to the next 6 to 8 generations. Not just your child's healthier, the next 6 to 8 generations. Now, the corollary is if you don't do that, you're passing on crummier genes to the next 6 to 8 generations. And a lot of this data about this epigenetics that gets passed on from generation to generation came out of some really not nice things. So like the descendants of Holocaust survivors have so many more health issues than people that didn't go through that. The descendants of people that had to live through the Dutch hunger winter of 1944, 1945 has so many health issues, and they can see these epigenetic things. But if you flip them the right way, you can really protect the next 6 to 8 generations. We're kind of the product of the previous 6 to 8 generations. And so you can kind of see this ball rolling downhill from generation to generation. People get sicker and sicker at younger ages, but we can turn that around. And if you can get a child's epigenetics really good early on in life, that really makes it super easy. So they did this lovely study out of northern Finland, where they took every child born in 1966 and they followed them for 31 years. And they said, okay, so half of you, we want you to do 2,000 IU of vitamin D the first year of life. Don't care what you do after the first year, but we're going to follow you for 31 years. What they saw was almost a 90% reduction in type 1 diabetes, that insulin-dependent diabetes. And you go, wow, that is remarkable. But you go, well, maybe not unexpected given how important vitamin D is, given how important it is to set the system at a young age. But then you look at that and you go, well, geez, what we teach people is we don't have really hundreds of different autoimmune diseases. It's one disease that can attack any body part. And this is why if you get one autoimmune disease and you don't get rid of it, you're going to get a second, third, fourth, and fifth. It's also why when a parent has an autoimmune disease, the children are so much more likely to get all the autoimmune diseases, not just the parent one, but it shows up in different people, different ways. So did this 2,000 IU of vitamin D first year life prevent all autoimmune disease in these kids? Well, not quite sure, but there are ever so many studies that vitamin D will prevent this autoimmune disease, that autoimmune disease, including if a mom's vitamin D is above 50 during pregnancy, not even great 80, 90, but 50, she'll automatically decrease the risk of her child ever getting multiple sclerosis by 50%. But then we know the flip side of the same coin to autoimmune disease is cancer. So you go like, geez, did this prevent cancer? There's ever so many studies on vitamin D and cancer, including if a woman's vitamin D is above 60, not 80, but 60, she's automatically decreased her risk of ever getting breast cancer by 82%. Wow, that wasn't too hard. But then what they also saw, so neat, was that these kids never end up getting schizophrenia. And we now know that all brain stuff is just brain stuff. It shows the same things that cause brain thing will show up in different people different ways, but all has a sort of like central mechanism. And so when they do the brain functional imaging scans, the brain disruption that causes schizophrenia is the exact same brain part that drives major depressive disorder. So the same thing drives different things in different people. So you go like, wow, these kids didn't get schizophrenia. Maybe, we don't know. They didn't look at it, but it's just protect them from like all brain stuff. And so if you can set the system before conception, set it early on, set it before age 19, it really, through epigenetics, is able to protect people and future generations. Now, even if your epigenetics don't get turned the right way by age 19, the body is so smart, you can flip genes the right way. And this is how you really turn around the chronic disease when it's already well established, is you're flipping the genes. And thus things like meditation, butyrate, that TUDCA I referenced, those things that work almost exclusively through epigenetics are so good at flipping the stuff. And it seems like probably that vitamin D receptor, because it can do all this, probably working through epigenetics. And so you're never stuck with your genes. You can flip them. And that's really what happens when people are healing.
Yeah, it's really interesting about, the trauma from previous generations. There's a really good book called It Didn't Start With You. I'm not sure if you're familiar with that, but that
I have not heard that one.
It really illustrates that really, really well, that the fact that, there might be issues you've got in your own life, your own health, And it could be because you've inherited the trauma, so to speak, from previous generations.
Yeah. Yep.
And it's interesting. I'm actually right now studying something called the emotion code. And you can actually help find and release kind of trapped trauma from previous generations as part of the process, which is really interesting.
Fascinating. Yeah. My wife is a psychotherapist, and she and I speak together oftentimes. So she's an expert in childhood trauma, adverse childhood events and their impact on health. And so even like a 3-year-old who there's a set of different adverse childhood events such as divorce, separation, substance abuse in the house, incarceration, physical abuse, sexual abuse, trauma, those kind of things. If a child by age 3 has 2 of those, they have like a 90% chance of being obese by age 8. And so even this is driving that childhood obesity thing. It's not what you eat necessarily. You can't eat crap. But this trauma, this epigenetics is such a big driver of chronic disease, both in kids and the adults eventually, and future generations.
Even the trauma can drive the poor habits as well.
That's true too. Yep.
Something that's, I guess, generally controversial, but I'm gonna ask you the question anyway. How much of a role, in your view, has the child vaccination program played in autoimmunity?
Well, I think it kind of goes back a little bit what you referenced with that inflammation and heat kind of a thing. So like here's Novak Djokovic, his inflammation was here. It didn't take much heat to throw him off kind of a thing. So when it comes to things that throw the human body off, it's kind of where the body is at the time that thing happens to how the body responds. So we tend to kind of talk about genetics, terrain, and environmental triggers. And so it's inherently hard to be a human being. There's always something going on, okay? But if your system is really clean, things don't tend to throw you off. And so if I look at terrain kind of like a backyard swimming pool. So if your backyard swimming pool, now it'd be frozen right now in the Rocky Mountains where I'm at. But imagine the summertime, lovely backyard swimming pool, south of France or whatever, crystal clear water, shimmering in the sunlight, oh so inviting. Or it could have algae, old bald tires, some old beer bottles are in there. Oh, it's just yuck, right? So that's kind of our bodies. Our bodies can be totally clean, or they can be all messed up. Vitamin deficiencies and hormone imbalances, all these toxins, all this. Well, if you're driving down the highway, here where I live, actually, it's 80 mile an hour speed limits, and everybody drives 90 to 100. So right in front of you, there's a rollover car accident. Oh my gosh, this person's never going to survive. And they crawl out. I'm okay. You're like, oh my gosh, that's amazing. But you could be at a stop sign, and the person behind you just spaces out for a second, takes their foot at the brake, just tap the back of the car in front of them. Everybody gets out. They look, no damage. They don't exchange information. But that person in the front car goes, I've had neck pain ever since that happened. It could just be the straw that breaks the camel's back. And so when it comes to vaccines, I kind of see it the same way. Most people's body goes, no big deal. But there are people who their terrain is not good, and that can be the straw that breaks the camel's back, including there's the autoimmune disease called autoimmune inflammatory syndrome induced by adjuvants. It's Schoenfeld syndrome. It's abbreviated ASIA. And this is where things like vaccines can cause autoimmune disease. Breast implants can cause autoimmune disease. Things that get in our body that aren't over there, like meshes, can cause autoimmune disease. These adjuvants, aluminum in vaccines, can cause this autoimmune disease process. And so sometimes it's not so much the trigger as it is, the status of the person, how clean their pool is when the trigger hits them. Sometimes people go, no, it didn't bug me. And somebody else goes, oh my gosh, that bugged me, and that bugged me really bad, kind of a thing.
Yeah, I mean, I ask because it's something I've been interested in for about 18 or 19 years. And I've I've read many, many books, and I've looked at lots of studies, and I've spent hundreds of hours watching documentaries and listening to scientists and doctors talk about the subject. And looking at the data, there does seem to be an almost direct correlation between the number of vaccinations and the rate of autoimmunity.
Yeah. And our bodies are getting more and more compromised all the time. More environmental toxins, more stress, more early use of antibiotics, more C-sections, more epigenetic stuff coming down from previous generations. It's just getting more and more challenging to be healthy. Yeah. And it doesn't take much to throw the body off when we got that kind of load that we're carrying. Yeah.
So, again, this is another question close to my own heart, I suppose. But how does the gut and epigenetics play a part in almost every skin issue?
So typically, if I see a skin thing, I'm thinking about 95% of every skin thing you can think of. The first thing I'm thinking about is the gut. One thing is the gut and the skin are intimately connected embryologically, but they're really connected. So typically, if the gut's going to be off, that's going to create every problem that drives up genetic changes, and that is going to be a huge reason why people get skin issues, including when you get acne. You're thinking, what's going on with the gut? Well, here's an antibiotic, but it's throwing the gut off that kind of locks you in place, kind of a thing. And so, so if I see any skin thing, I'm thinking, what's going on with the gut? Just like the gut's the second brain, you think, well, if you see any kind of brain stuff, first thing I'm thinking about is the gut. Kind of a thing. You fix the gut, the skin clears, the brain clears, and that all happens through the gut being the central mechanism. You're fixing everything that throws off epigenetics, vitamin deficiencies, hormone imbalances and deficiencies, cortisol, you're getting rid of toxins, the infections are leaving. And so once again, that's kind of where that gut is such a central mechanism, but also where, the skin and the gut. And actually on TV here in the United States, on a morning TV program out in New York, they had a dermatologist on about skincare products for the wintertime. And I couldn't believe it, but she said that, well, one thing I remember is the skin is really connected with the gut. So you have to have a healthy gut if you're going to get the best skin. And I couldn't believe that I heard that. I'm like, oh my gosh, things maybe are changing a little bit here. People are thinking about this stuff.
Yeah, that's good. That's good. Yeah, I mean, I get really frustrated when I'm on a number of Facebook groups where people ask questions about acne. And if I've got a moment, I'll try and answer them. But it's very difficult because people are coming in with the paradigm that, there's going to be a magic product or a magic pharmaceutical and it's going to solve all their problems. And it's very difficult to give someone a full answer. I mean, the book that I've written on acne, it's a 50,000 word book. How do I explain that in one Facebook post? It's a bit of a challenge, but there's a whole chapter on the gut skin axis and how to rebalance the microbiome.
Beautiful.
But the other skin conditions that I guess are more obvious in terms of being autoimmune are eczema and psoriasis.
Sure. Yeah. So you're kind of talking about the immune system issues that try to drive skin things. Yeah. So this is where typically we'll address those the exact same way we would address any autoimmune disease because they're all the same disease, just show up in different people different ways. I think sometimes with some of the skin stuff, it's easier for people to think that they fixed the problem if they use, a prescription medicine that clears the skin. They think, oh, I can see that I'm healthy now, when that's not the case. Yeah. But if you can fix the gut, the skin's going to heal, your energy's going to get better, you'll sleep better, the brain fog clears, all these other kind of things will clear at the same time. But when you see the skin stuff, I think it's even more of a red flag that I got to do something to change what I'm doing because this is not right. Yeah. There's definitely something going on. I can see it every day in the mirror. I can see it on my skin. You might kind of write off, I got a bad knee because I play tennis. You can kind of go a ways with that because, of course, tennis players have bad knees, but not realizing it may be something different like gluten. But when you see your skin stuff like that, it's like, nah, that should be a red flag that it's time to really, get to the heart of the matter and change this because you're going down the wrong path.
Yeah, I always try and explain to people that as horrible as it is having a skin condition, and it is horrible, and some people can feel suicidal.
Oh my gosh.
That, in fact, the symptoms that you have are a blessing. because what they're doing, they're making you aware that there's something wrong on the inside. Just like physical pain is trying to tell you something. If you put your hand on an oven, put your hand on a hot plate, the symptom is very useful, because if you didn't feel the heat on your hand and you left your hand there, you wouldn't have a hand. And it's the same with any symptom, and with skin conditions as well. Yes, you might have this horrible acne or eczema or psoriasis, and it's horrible, but actually it's making you aware there's something far more serious going on that you need to address. And looking at it from an acne point of view, probably the most effective medical treatment is Roaccutane, or isotretinoin as they call it now. And it doesn't work all the time, but it does work a lot of the time. But then you're left with lifelong issues. It shrinks your sebaceous gland, so you've got dry skin for the rest of your life. So you've just switched one for the other without treating the root cause. And you might end up 10, 15, 20 years down the line with a cancer because you haven't dealt with the root issue. But if you deal with it from the root cause, then you won't have that issue going forwards.
Because sometimes the first symptoms that people experience is very subtle. Like people with Parkinson's, the very first thing they notice is constipation. But that's 15, 20 years later, they start getting the Parkinson's signs. But it's like, that's such a subtle sign to the body that something's wrong, that people, don't take it for what it is. It's so easy to use a laxative, that kind of stuff. But when it comes to the skin stuff, it's that red flag that there is something going on inside that I need to take care of. And if I take care of it, the skin will get better. But it's not as subtle as maybe a little constipation.
Yeah. Great. So I've got one more question for you. What motivated you to write the book, The Nurse Practitioner's Guide to Autoimmune Medicine?
So we really feel strongly there needs to be an expert in every community that knows how to do this, who knows where this stuff comes from and knows how to turn it around. Otherwise, this would be really challenging for the people in that community to know that there's other options besides, here's a medicine, that's your only option. They ask the doctor that diagnosed the autoimmune disease, where did this come from? We have no idea. We will never know where it came from. Well, that just means that person doesn't know where they came from. Well, can I make it go away? Nope, can't make it go away. This is lifelong. The only option is this. They won't know there's another option. And so there really needs to be an expert in every community. Nurse practitioners inherently are trained much more holistically than medical doctors are, where they are trained to kind of look at the person, not necessarily the disease. Let's look at the person with the disease, not the disease itself. And because of that, I think they're a perfect specialty to really take this revolution in autoimmune and chronic disease management to where it needs to go, where we're not just offering people bandage medicines. If you need a medicine to get through your day, you got to have a medicine to get through your day. Just let it buy you time to fix an underlying issue. But we really got to get at these root causes that drive this. And so I think what we're trying to do is educate nurse practitioners through the book you mentioned, but also through training programs, including ones that have continuing medical education credits, that we know where this stuff comes from. We know how to make it go away. We're trying to give nurse practitioners the option to become the experts in their community to help not only children, not only adults, but also through epigenetics, really help the next 6 to 8 generations become healthier.
Awesome. Well, this has been great. I mean, one of the reasons I started this podcast, amongst many, but one of the reasons is because I wanted to learn from people like you. And it's been really great. I've learned some really good stuff today, and I'm going to go away and certainly look into a few of the things that you've mentioned today. So that's been great.
Maybe I'll pick up a racket and start practicing so we can play sometime.
Yeah, definitely. And I've actually written a book on tennis conditioning as well.
Have you really? My goodness.
So, Dr. Bilstrom, where can people find you online?
Well, I got to say, when at Wimbledon, when the TCU coaches and TCU players are playing, that's my alma mater. Okay. I'm a TCU varsity tennis player. So when I watch Wimbledon and see them and the coaches with the TCU hats and the players, I got even a warmer spot in my heart for Wimbledon than the warm spot I had my whole life before that. But thank you, sir, for mentioning that. Yeah, so people want to get in contact with me. The website is drdavidbilstrom.com. And we have 2 different levels of training for non-medical people, 2 different levels of training for medical people. We have blog posts about all kinds of things, including the vitamin D receptor, the estrogen dominance. I have over 100 different videos about the science of this on my YouTube channel. Everyone has, I specifically talk about a scientific article or 3 or 4 about all this, including the children we see from around the world with the juvenile rheumatoid arthritis. 70% of all autism is one particular autoimmune disease. We see kids from around the world that reverse the juvenile rheumatoid arthritis, reverse the autism. Special place in my heart for the children out there. And I just ask people to please spread the word that this stuff is knowable and it can be treatable.
No, that's great. Dr. Bilstrom, thank you so much. This has been really, really informative and really enjoyable. And I'm sure the audience are going to love this episode.
Thank you so much, Lee, for having me. It's my pleasure.
My pleasure too. So that's all from Dr. Bilstrom and me for this week. But don't forget, you can join me same time, same place next week on the Radical Health Rebel podcast. Thanks for tuning in. Remember to give the show a rating and a review, and I'll see you next time.